Hello and welcome. The world's largest COVID-19 vaccine rollout has begun in India on the 16th of January 2021. 30 million Indians are going to be inoculated in the phase one, or the first phase of this drive. About 3,000 or a little more than 3,000 sites are active today. The Prime Minister launched it this morning, and he also said that the people who need the vaccine first or will get it first, or who need it most will get it first. Now, as we know, frontline workers, security forces, police, fire brigade, sanitation workers, these are the categories of people who are going to get it first. Now, it's been a mixed bag of sorts. There has been obviously some concern about the vaccine itself and what it can do and whether it is efficacious. Equally, there is anticipation, an eager anticipation about obviously getting a vaccine and moving towards recovery. So let's get a ground report from two of my colleagues in Mumbai and Varanasi to understand what exactly happened and or how it transpired. Joining me first from Varanasi is Sadhika Tiwari, who's at the Integrated COVID Command and Control Center there. Sadhika, thank you for joining us. So how's the day been?
Yeah, I think it was, there were a lot of apprehensions actually to start when everything started, but I think Varanasi actually, the confusion was a lot less compared to other places because we didn't have CoVaccine and Covishield together. The Varanasi, the entire district just had Covishield. The turnout has been nearly 75%. Why did the rest of these people not turn up has been, I mean, there have been a lot of conversations. In fact, I was inside the COVID Command and Control Center and I was talking to the policemen there. And they were saying that, you know, there have been reports of people who got vaccinated and fainted. Clearly, I mean, these reports are not true. I spoke to the CMO today, and no such reports have sort of come up in Varanasi. There was one instance of somebody, of this woman, a 50-year-old woman, feeling some jitters, but then the doctor said her vitals are fine, and it was not because of the vaccine.
Right.
So far, everything was fine. One sort of miss that we saw today was that this entire data keeping for the program was supposed to happen on the CoWIN app. Everything was supposed to be done digitally. The manual recording was just sort of on the side. I mean, that was the plan. But that was completely thrown out the window today. There was not even a single center where this app was being constantly used. Everything was being done manually. All registrations, all data verification was done manually. So, I mean, the turnout was pretty decent. I mean, 75 to sort of 80%, and we're still waiting for the final numbers to sort of come in.
Right. So here's the question. So the, people know which vaccine they're getting, right? So Covishield is the Serum Institute Oxford product, whereas Covaxin is the Bharat Biotech India product. Now, it is our understanding that people don't have a choice which vaccine they can take. But you're saying that in Varanasi, at least to the extent that you know, the only vaccine that's been given out is the Covishield, which is the Oxford Serum one.
Right, exactly. So the storage center here in Varanasi just got 2 boxes, both of which were Covishield. So there's no Covaxin here. As far as like the choice or the information of the fact that people being informed basically about which vaccine is being administered to them is slightly dodgy, because even though on the consent form, it does mention that they're being administered a Covishield vaccine, or it mentions the name of the vaccine, people don't really, I mean, it's not communicated to them. And when we're talking of class 4 employees, a lot of whom were vaccinated today, they were not aware of the vaccine or of the name of the vaccine or the fact that, you know, there are 2 options that they could have chosen from or anything of that sort.
Right. So, and all these people who got vaccinated today have to come back for a second dose. So, are they aware and are they looking forward to that? In general?
Yeah. So a registration card has been given to all the people, and there's a phone number. So they got a message today morning. So they're hoping to get another message. Although the CMO of the district also told me that 28 days is sort of like the minimum gap which needs to be there. These people could come back within the window of 3 months, 28 days to 3 months, anytime in between.
Right. And the people who came today, largely, Sadhika, would you say that they were older, middle-aged, younger, and belonging to these categories, of course, but any broad descriptions?
So these were middle-aged people largely. I mean, these were either like senior officers, senior doctors actually, or they were class 4 employees largely in Varanasi. So frontline health workers, when we say frontline health workers, we mean staff nurses, etc. as well, which was not the lot today. It was either class 4 employees or it was the senior doctors and officials.
Right. And people, are you getting a sense that people are not going to take things for granted? I mean, they've got one dose, but they're all still following all the norms that they're supposed to follow, including social distancing and masks?
That was, I mean, of course, like 10 o'clock, the entire sort of drive began. By 2, the chairs that were kept at a certain distance were sort of like all huddled into. Everybody was huddled into a big circle. And as I was talking to this policeman today, he said ki, in states like Uttar Pradesh and Bihar, where everyday struggle is for food, people don't really care about like the vaccine or social distancing or any of those things. So I mean,
Right.
these employees also who've come for the vaccination, it's mostly because they've been called and they didn't really have a choice of saying no. So they just turned up.
Right. And I'm assuming that everything that happened today, that all the vaccinations that happened today went off smoothly. Is it likely to pick up tomorrow? The pace, is it likely to pick up tomorrow from what you
So
understand?
here we don't even know. So in Varanasi, we're not sure if the vaccination drive is going to happen. So they're saying Monday and Friday is supposed to be the days when it will happen. But officially, there is no word. Like I'm still waiting for the CMO to give us the final days and the next date on when the vaccination drive is going to happen.
Okay. Sadhika, thank you very much for joining us and giving us that excellent report from Varanasi. My colleague Shachi Sutaria is standing by at the Arun Cooper Hospital in suburban Mumbai. Shachi, thank you for joining us. What have you been seeing today?
For us at Anant, it started with a bang and aplomb. We had at 10:30 when the PM was talking, there were 5 people from Anant Cooper who were on the Zoom call with him. While everybody watched the live link, they watched the Zoom call. So at that point of time, there was a lot of aplomb with a lot of media professionals there, as well as people coming in for the vaccine. But as the day continued, the number went down. So out of the 500 people that Aaron Cooper was expecting, only 262 turned up. So we have like a 52% turnout instead of the 100% turnout they were looking at. And moreover, from the 52%, also they were all scattered. So even though they were they were not only from Aaron Cooper, but they were all either admin professionals or civic officials or doctors and staff nurses both together. We didn't see any class 4 workers today at Cooper. So we had doctors, we had staff from Aaron Cooper itself, from Nanavati Hospital
Right.
in the vicinity, from Seven Hills, and which is the Andheri East COVID Center. We had civic officials from the BMC ward, and suburban diagnostics representatives as well.
Right. And is this, we were talking, as you know, to Sadhika in Varanasi just now, and she was saying that she doesn't know, at least at this point, whether this is going to resume tomorrow or there will be 2 dates a week. So what is it likely, or what is it that you're hearing about Mumbai?
So we don't know the complete schedule so far, but the doctors we spoke to today are turning up tomorrow. So the drive is definitely happening tomorrow. Further days, I think they will decide once. It depends on the turnout, how many people actually turn up. Because when I asked them about what happens to the 52, the remaining 48% who didn't turn up, a doctor told me that the government does not provide any such details on that. What happens to when people don't turn up? Will they get another opportunity? Will they be re-registered? The vaccinators themselves are pretty unclear about that.
Right. And any reactions? I mean, reactions. When I'm now first asking about medical or health reactions from any of the people who came for vaccination today.
Not really. They were kept in observation for 30 minutes, and people with prior history of allergic reactions. We spoke to somebody who has a history of allergic reactions. Were just kept in the room for a longer period of time, and a special observation room was kept for them. But nothing serious. We did not see any reportings of anybody fainting or anybody having a severe reaction to the vaccine.
Right. And what's the general sense, Shachi? Is there a sense of anticipation? Do people want to take this vaccine, or are they taking it because they have to, because of the jobs they are in?
So some people we spoke to were apprehensive because they came to know about it only today morning, and since it is voluntary, it was left to their choice. So definitely, some of them chose to come in, while they themselves said that some of their colleagues decided not to come through. So that is also a general reaction, basically, about whether people actually want it or not. Since the vaccine is voluntary, it depends on them, and the apprehension is clear. A couple of people who beneficiaries we spoke to also suggested that they were pretty unclear, but somebody told them, let's just go check the scene out and then figure out whether we want to actually take the vaccine or not. They saw the process at Cooper, thought it was smooth enough, and decided to actually take the vaccine and got there for sure.
Right, Shachi, thank you very much for that great report on ground, R.N. Cooper Hospital in suburban Mumbai. Joining me now is Anant, Dr. Anant Bhan. He is a researcher in global health and bioethics, in bioethics and health policy from Bhopal. Dr. Bhan, thank you very much for joining us. So a day has passed. Clearly, from the little ground reports that we've seen now, it's not like people are rushing in. There is, I mean, there is anticipation, but it's measured, and people are going about it carefully. What's your reading?
Yeah, I mean that's true of what I have been hearing as well. I think it's not surprising because I think in most sites the lists have undergone changes. People only found out sort of last minute. There were, I think, chinks with the server, etc. But it's also the case that people have concerns. They want some more information. So over time, I think as they get used to the idea of vaccination and people taking vaccination, there might be an uptake and an increased flow coming in. But we'll have to wait and see. You know, the system is out there now. There hopefully will be more communication around days when these vaccines are available and enough of advance notice so that people know when they are being allotted vaccines and which day to turn up. So we might see a positive swing up. But at the same time, I think we'll also have to keep a watch out for any concerns about vaccination, a need for more communication. We also saw, I think, one resident association at least clearly coming out and saying that they were uncomfortable with the choice of vaccine which was being offered to them. So I think those are the kind of concerns on the ground which needs to be listened to and responded to ensure that there is constant uptake.
Right. Now, this is an adult vaccination program, and therefore it is unique, and more so because of its scale and size, not just for India, but anywhere in the world. So is there apprehension you feel because it's an adult vaccination program, like any of us obviously have not had a vaccine for decades, whereas, you know, maybe things would have been different if it was only for young people or children?
Yeah, it might be partly that. I think it's probably not primarily that. Primarily, I guess it's because of the unknowns. You know, everything has happened at rapid pace, and I think even as you know, there's been some level of controversy and debate over the recent weeks around even the approval process for these two vaccines. So I think that probably adds to the uncertainty. Now, health workers tend to be a more informed set of individuals with regards to vaccines and the vaccination process than other categories of individuals. They've seen this happen in their facilities. So one would think that they would be more comfortable with the idea. But that having been said, you know, it's valid for them also to have concerns. It's not a mandatory vaccination exercise. It should certainly not be. So if it's a matter of choice, you have to give time to sort of to individuals to think about it and take that decision. So again, we'll have to wait and watch what the long-term implications might be. And if we start to see, you know, a decline in interest, but hopefully that will not be the case. And more importantly, there will be confidence building done constantly, because at the end of the day, the vaccination will only succeed from when you have the vaccine available, but at the same time, people willing to take the vaccine and coming forward for that.
Right. You know, so we saw this report from Norway, which said that about 23 people have died after taking the vaccine. Now, the details are available only for some cases, but essentially it seems to be that the vaccines could be risky for very old and terminally ill patients. So, should we read anything into that, and therefore be careful about taking this vaccine, or for some type of people to take that vaccine?
Yeah, I think, you know, again, you know, India is relatively a younger population. Many other countries also suffered the brunt of morbidity and mortality much more than we did. Not in terms of absolute cases, but in terms of the severity of those cases and the you know, the deaths caused due to COVID-19. So one has to recognize that, you know, the more older you are, the frailer that you are as well. And as compared to an adult, the physiology also changes. You know, also many of them have underlying conditions. So how much of an adverse event could be attributable to the vaccine? I'm sure they are doing good quality investigations to look into it. But yes, I mean, it seems to be that any of these events should be seriously looked at. You need to learn from that and immediately make amendments in your vaccination program if there is anything to worry about. In fact, that was already done in countries like UK, where on day one, when they started seeing, people who had a history of severe allergy, also seeing a couple of events like that, and they decided that that would be a no-go in terms of
Right.
getting the vaccine, and they put out an advisory. So I think that is certainly a learning exercise we should also, have in our own country.
Right. Now, there are two vaccines. My colleague from Varanasi said that the vaccine available in at least the center where she was the Covishield, which is the Serum Institute Oxford combination, as opposed to Covaxin, around which there are some concerns because the efficacy data is still coming in. So people now don't have a choice. So what should people do, or can they do if if you were, let's say, wanting either of those two vaccines, and you would only take one of those, whichever maybe you've chosen?
Well, if I had the choice, I would choose the vaccine where there is efficacy data. But that having been said, you have to understand that both vaccines are probably safe vaccines, because there is safety immunogenicity data for both of them. We have efficacy data for one. The other one, we are awaiting that data. That might actually turn out to be also pretty good. So I think in a few weeks' time, this dilemma hopefully will be addressed, and we will not have to worry about that issue. Having said that, as you rightly pointed out, there is no choice, and every person who is a potential recipient has to make that decision for himself or herself. I would suggest that you look at the data, the evidence which is at least there in the public domain, ask questions, because that is your right, and try to discuss this with your family, your colleagues, especially if you're health workers, and then come to a decision, because at the end of the day, it has to be an individual decision which has to be well informed. If you decide to take vaccines, I think part of your civic duty is to look out for any adverse events, which you should immediately report, catalog, because that can help us better understand the safety profile of these vaccines as we go to scale and in the long term.
Right. So, when you take an antibiotic, and India, most people help themselves to these medicines over the counter, even when not prescribed. You usually take a call on the manufacturer, or sometimes you take a call on the manufacturer, though there may be many manufacturers or drug makers who offer the same medicine or the same composition, generic composition. So in this case, should people be allowed to choose? And assuming if they can't choose, then should they wait?
Yeah, so there's two parts to that. Both the manufacturers currently in the fray, they're both well-established manufacturers, pretty good manufacturers. They supply vaccines not just to India, but to many other countries. So I don't think there is anything to worry on that count. The second aspect is the matter of choice. Unfortunately, choice is not there almost in any country. So it's the same here, except here you have a situation that there are two different vaccines at two different development pathways which are being used. And I think that is what is causing some concern. The third element is there might be choice available if and when there is a private market which opens up, but that will also be something to worry about from an equity perspective, because imagine if I don't have access to financial resources and I have to wait for my turn in the queue through the government system, but yet you are rich and you can go and buy it from a private provider and you can hence jump the queue ahead of me. So I think that will open up a lot of difficult questions from a societal equity perspective. But as of now, there is no choice. And the only choice you have is to take the vaccine or opt out of the vaccination. And whether that means you retain, and whether that means you retain that option of taking a vaccine at a later date, we don't yet know, because I don't think that's been clarified. So can you wait for a few weeks and then say, okay, I'm ready to get the vaccine now? I don't know if that is being allowed.
But there is a gap, as I understood from my colleague Sadhika, that you could take the second dose much later. So it could be anywhere between 28 days and 90 days.
Yeah, I think they have made some recommendations. I presume we'll have to wait and see how that pans out, because there is the approval also mentions a certain spacing, and you have to usually follow what the package insert says and what the government guidelines are. So while there might be a little bit of flexibility, I don't think there will be a wide variation, because again, you have to try to follow what the approval process mandated. That having been said, there's been a lot of learning in many other countries where they have increased spacing for logistical reasons, but also because in some vaccines they've seen with increased spacing, you also seem to be getting higher efficacy. Though again, a lot of that requires you to look at the data in close detail and make those decisions available. I guess, if they are scheduling vaccinations, they will be sending out these kind of reminders and follow-ups to ensure that people come up, and that will help with logistical planning, because, you don't want to have too open a a window where you're not sure how many people are turning up on a particular day because
Right.
how do you plan to get 100 people in regularly then? So I think there needs to be some planning around that, but more communication around those spacing time points would be useful.
Right. So if you look at the journey that we've been so far or been in so far, which is almost a year now, how would you characterize the current phase? Vaccination has begun, but we are a large country. This current phase is only 30 million doses. Would it start having an impact? Should we assume that it will have an impact? There are many other countries, very small countries, of course, like Israel, where the pace of vaccination is so high that they may vaccinate the whole country in a few months. Now, we are obviously very far from that. On the other hand, our case fatality ratio seems to be lower. We don't seem to be getting as hit as some of the other countries. So should one form some kind of educated guess on the basis of that? And if so, can one change one's behavior, or what would you be cautioning against? Right. I think we've lost Dr. Bhan. Dr. Bhan, are you there?
Yeah, can you hear me? I'm not sure if I'm back on.
Yeah, I can hear you. Yeah, you're back. Sorry, could you hear my question?
Yeah, I think I got the gist of it. Yeah, so I think we are at an interesting cusp of the. Sorry, yeah, I think I got your question around where we are in terms of the evolution of the pandemic as compared to many other countries. Was that sort of the gist of what you were asking?
Yes.
Right, yeah. So I think it's an interesting cusp of the pandemic. I think, as you were rightly pointing out, we have a decreasing case count in India. We also have a low case fatality rate, at least based on official data. The vaccination is focusing on certain priority populations which are most at risk in terms of their occupation, but they are only a small segment of the population. So per se, the vaccination in absolute overall terms will not make a huge dent. And hence it's also important to remember that no vaccine also is 100% efficacious. So it's only going to be X% efficacious, and hence following all the precautions that we've kept on talking about is extremely important, and hopefully everyone will continue to do that, including those who get the vaccines. Over time, vaccines, as they keep getting rolled out, and if as efficacy pans out, we will start to see hopefully more immunity and hence protection, hopefully from any future spikes of infection. But I think we are in a lucky space right now with lower infections, lower case fatality, and now vaccination starting off, even if there are some questions around the vaccines involved in terms of the lack of efficacy data for at least one of them. And the other vaccine, we haven't gotten local efficacy data. So hopefully through the rollout, we'll also find out more about that.
Right. So last question. So at this point of time, if my name were to come up, or if I had the opportunity to go and get myself vaccinated, should I do it or not?
I think you should take an informed decision by reflecting on it. Look at what the evidence is. Don't be swayed by misinformation. I think everyone has to take an individual decision here.
Right.
But also remember that there is a fair body of safety data behind the vaccines, at least whatever is possible in the pandemic situation, with expedited timelines. If there are any concerns, if these are more related to processes for regulatory aspects and around the lack of efficacy data. So, in that light, you should take that decision. And if you feel that you are not ready for it yet, I think you have a right to wait as well.
Right. Okay. Careful, considered decision, but it's your decision. It's your option. It's completely voluntary. So decide before you go in. Dr. Anant Bhan, thank you so much for joining us, and hope to see you soon again as we continue to fight this dreaded disease.
Thank you so much for having me.